What would be the most effective type of transfer from bed to chair for someone who is non-weight bearing on a particular side?
So, with someone that's non-weight bearing, usually it's after a traumatic injury, such as like a fall, and then they break their hip or their femur, and then they have it pinned together, would be an example. And with non-weight bearing on one side, means we can't put any weight bearing. So, once we get someone up to the edge of the bed, we want to make sure we position the chair on the strong side or towards the side that they are able to bear weight on. And that's kind of our starting position. It's easier to transfer with that strong side. So once you're there, you've got to try to figure out if this patient's more high level patient, um, such as someone that's younger that can probably do okay on one leg, or are they a low level patient, maybe a little older, maybe a little heavier and weaker, depending on how they did with surgery. So if they're a high level patient, I want to make them do as much as they can on their own. So I would first scoot them up to the very edge of the bed. I normally try not to raise the bed so that I challenge them and kind of see how they do um, if they were to go back home. And then once they're at the edge of the bed, I put a gait belt and I make sure that it's right around the belly button or a little lower where their center of gravity is. And then put a walker in front of them most of the time so that they can have something to hold on to as they stand. And when I'm working on them getting up, with that gait belt, I make sure that I try to bring their center of gravity over their base of support, which is their feet, so that when they try to stand up, they don't just push themselves backwards. That's why I like to scoot them up to the edge of the bed. And then when they're standing, and if they can stand from pushing off the bed and grab the walker, and they're okay to stand on that good leg, then I just work with them on turning that walker, pivoting over that strong side, bringing their bottom towards the chair, and then sitting down in the chair. So that's for a high level patient. With a low level patient, if I don't think that they could make it that way, and I think the walker is going to be in the way for me to help them, then I'll do more of like a standing pivot transfer where I'm blocking their knee. So I'm coming up close to them, um, putting my knees around the knee of their strong side of the leg that's going towards the chair, and I'm right in front of them, putting my knees around their knee, holding on to their gait belt, where I'm pulling their center of gravity and using my knees around their knee as a lever point to be able to get them into standing and then pivot their bottom towards the chair and go back down. And that's how I would transfer someone from the bed to a chair.
Very cool. Um, so the next one would be more so about ultrasound. Can you tell us a little bit about that
Yeah.
modality?
So ultrasound is a modality that uses sound waves to a frequency that's tuned a little bit different than like if you use an ultrasound to look at a picture of like a baby in a mother's womb. Um, where on the physical therapy side, we use ultrasound tuned to a frequency that can break up scar tissue, can work on the elasticity of tissue and collagen, say in a scar or in a tight muscle, and it can be used. That frequency of sound waves is turned up to where it causes a lot of mechanical vibration to go in. It can actually heat up the tissue, and it has benefits so that, like, whereas if you were to use a hot pack that may not get deep enough, the ultrasound can heat deeper tissue. So if someone has like a contracture of a tendon and it's too tight and we can't stretch it out, we can use the ultrasound to heat up and loosen up that muscle or tendon. Or if someone's got a scar that's very tight, it's not healing on like the myofascial level, we can use it to heat it up and work on that. It also brings inflammation down. But another cool way that you can use ultrasound is called phonophoresis, which is a fancy term for using those sound waves to put a topical medicine to push into deeper structures. So if someone has an inflammatory problem, like a tendonitis problem on the superficial tendon, we can use that ultrasound to put like a dexamethasone gel on that body part, which dexamethasone is like a steroid and anti-inflammatory, and we can use the ultrasound to help push that into the deeper layers. Whereas if we just rubbed it on the skin, it would stay more on the skin level. So those are two ways that we use ultrasound.
And a maxi jack. How would we use a maxi jack in a hospital setting?
So a maxi jack is basically a really fancy, cool air mattress. But basically, if in a very poor case that someone were to fall on the ground and they're too heavy to get up just by lifting someone up, or if we're worried about injuring someone's shoulders or arms by lifting them up by their arms, what a maxi jack is like a deflated air mattress that you can put underneath them and then basically fill it up really quickly with a fan. And what that maxi jack does is lifts them up to about the same level as their hospital bed, so that you don't have to worry about injuring someone or injuring your workers, trying to get them off the floor, and then you can just slide transfer them to the bed from this really big air mattress maxi jack.
All right, thank you very much, David. We
You're welcome.
appreciate everything. Thank you.